CAR T cells are going to be a great step forward for myeloma. They clearly have activity, and in the relapsed refractory setting, that activity is greater than any other drugs we've seen for those patients. So I've no doubt they're going to be useful for patients in the upfront setting. But the question is, how do we make a strategy to get drugs from the relapsed refractory setting to the newly diagnosed setting, where we might start to see really significant changes in long-term outcome, and in some cases maybe even cures? And so it's a conundrum of how to do that. And I've been interested in genetics and using genetics to define risk status. So if you had a group of patients that were newly diagnosed that were high risk, and that risk was the same as for patients with relapse disease, where we normally evaluated new drugs, it would be ethical to look at that group of patients. So we've succeeded in coming up with a definition of high-risk, newly diagnosed patients that would be suitable for a clinical trial. And so the KARMA study is looking at this group of patients. So we use clinical and genetic evidence for high risk. And you can do a study in that patient group looking for the benefit of CAR T cells. And so that would give you this knowledge then. So if that was a successful positive trial, it would say in the upfront setting for high risk, CAR T cells outshine standard therapies and improve outcomes. And then almost you could extrapolate, if it's active for high-risk disease, the same would probably be true for low-risk patients. And that would give you the impetus to do a clinical trial for those patients, which I think will be great for myeloma patients overall. And ultimately, I can see CAR T cells for the majority of upfront patients. And I think they will ultimately replace autologous stem cell transplantation, which is a statement I've been loath to make in the past. But they are so active, they might be more active than our standard treatment for younger patients. And we certainly need to move forward and evaluate this as a concept.